When delivering the Level 3 certificate in Assessing Vocational Achievement, it's important that we follow our company policies and procedures, and then we make an assessment decision that we can make in accordance to VARC, so validity, authenticity, reliability, currency, and sufficiency. Failing to do this, you can open yourself up to complaints. As a training provider, you need to make sure that your complaints and appeals process is available to your learners, and when our learners sign up for the Level 3 certificate in Assessing Vocational Achievement, they're given copies to our policies and procedures, so if you're not happy, then learners can complain. Complaints should be seen as an opportunity to improve and not something that's personal against you. And during your time as an assessor, you'll build a relationship with your learners and you'll have a better relationship with some learners over another, and that's normal. To remain professional, the differences in the relationship should not affect the assessment process or the way that you assess work. At some point during your career or during your assessing career, a learner will complain they're not happy with an aspect of your assessment process. Normally it's when they feel that they have been fairly treated, or that you have treated them unfavorably when compared to someone else. This is one of the reasons that when you create assessment plans, you determine clearly what the assessment expects for the learner to pass an assessment, so it is crystal clear, which enables everyone to see in clear black and white what is needed for the pass and what constitutes as a referral. Let's use first aid as our example. So we need our learners to perform CPR. Our assessment plan cannot say just CPR, it's just too brief, and there are so many variations of what is accepted from one trainer to another. So to be very specific in the assessment criteria, we need to add things like chest compressions, so how many? So we're going to look at adding 28 to 32 chest compressions, and also we're going to ensure that each chest compression reaches a depth of 5 to 6 centimeters. And this is added to our assessment criteria. So now it's more detailed, but as you can see, we've now set clearer requirements that learners must complete 28 to 32 chest compressions and reach a depth of 5 to 6 centimeters per compression to pass the assessment. And this is much clearer and can make your assessment decision more transparent, which your learners are more likely to accept if they didn't meet the assessment criteria. First, when and if a learner complains on a Level 3 certificate in Assessing Vocational Achievement, then a learner would first raise this with their tutor, who will remark the work. If the learner is still unhappy with the decision made, then the work will be marked independently by the IQA. If the learner is still unhappy with the decision, the learner can now refer the decision to the centre manager, who will then view the assessment process, assessment records, and then make a final decision. If the learner is still not happy with this, then the learner would be encouraged to raise this with the awarding body to confirm assessment decisions. And this is the last resort, and something we encourage as our company values transparency in our decisions and provide everyone with a fair treatment in accordance to the Equality Act.